Did you know your liver is your hardest working organ? That's why you need a healthy liver. Hepatitis, for example, is a serious liver disease that can kill you if you don't treat it in time. Get a liver test today. Your liver needs your love too.
Assalamu alaikum everybody. Welcome back again to the second episode of our session, Liver Health and Hepatitis Prevention. मैं आपकी host Fania Osmani, and with my team, Pakistan Welfare Organization Australia, we are collaborating with Hepatitis Victoria today again. And last time के session में we discussed a little bit about hepatitis and what is hepatitis करता क्या है, hepatitis के clinical signs symptoms क्या हैं, and how as a community we can work against hepatitis. आज के इस सेशन में, this is going to be episode number 2, we will discuss what is hepatitis C, उसकी transmission routes वगैरह हम सब आज discuss करेंगे. So for that, I will like to again introduce our guests, Neelan, Aikut, and Dr. Dhanak. Neelan is a health promotion officer at Hepatitis Victoria, and she was currently stepped up as a acting community participation coordinator since the COVID restrictions were introduced, and she's working to bring health literacy and resilience among communities. Whereas Dr. Dhanak is a medical doctor. She had her experience in obstetrics and medicine in Pakistan. So we're going to introduce you to them. Hello, Dhanak. Hello, hello, Neelan. How are you?
Good. How are you?
I'm good. Thank you so much. Thank you so much. So, Neelan, last time we discussed a little bit about hepatitis, can you tell us how many types of hepatitis there are? We didn't get to that actually, yeah.
Yeah, well, hepatitis itself means inflammation of the liver, but if we're talking about which can happen from just drinking too much alcohol, actually, but if we're talking about viral hepatitis, we have hepatitis A, B, C, and a D and an E as well. But mostly we speak about hepatitis B and C because they're the two that can really cause the biggest trouble with your liver and ultimately can lead to death.
So since we are focusing more on hepatitis C today, can you tell me how hepatitis C is transmitted?
Sure. I wonder if it would be okay if we just pull up a slide really quickly to give an overview of hepatitis C. So we'll just pull that one up, and it's just, don't bother scrolling. It's just to give you a really quick view, snapshot around hepatitis C. So in Australia, we have 182,000 cases. That's actually dropped a little bit since this was made, 71 million worldwide, and over 46,000 in Victoria. So globally, that's nearly 400,000 deaths. And 66 liver transplants in Australia attributed to hepatitis C, and over 500 deaths attributed to hepatitis C in 1 year. So we don't need to go through the rest of that. I just wanted to kind of set the scene with that. And we can take that slide down now, but it's an example of some of the resources and information that Hepatitis Victoria pulled together. Yeah, so hepatitis C is a blood-borne virus. So that means the blood of somebody who has hepatitis C, if it gets into the bloodstream of somebody else, that person can get the hepatitis C. So it's something that we commonly hear about from, I think you might have seen on that resource then, that people who share needles, that's a really effective way to share hepatitis C. Also, same for needles through medical procedures and through tattooing as well. And also, before 1992, there were blood transfusions that occurred. That was before we learned to screen the blood, which we do now. So if you have had a blood transfusion after 1992 in Australia, that's not something you need to worry about. But if it was before 1992, you should maybe have a test and just check that you didn't get hepatitis C.
Okay. Are there any vaccinations available for hepatitis C?
No, unfortunately, medical science is still working on that. It would be amazing if we had a vaccination, but at this point, there's no way to protect yourself from hepatitis C other than making sure that you manage all possible ways that somebody's blood might get into your bloodstream. So that's the only thing that you need to manage to avoid getting hepatitis C.
Okay. So, how good is the system in Victoria for, accessing the treatment for hepatitis C?
Yeah, look, every GP will be able to write you a referral to get a blood test to find out if you have hepatitis C. It's usually a 2-stage test. So the first stage would be to see if you've ever been exposed, because once you've been exposed to hepatitis C, it will always be, the antibodies will always be in your blood. So that it's kind of left a calling card. So the first test will be seeing if you've ever been exposed. And if it comes back positive, then they'll usually do a second test, which is also from the blood, which is called a PCR test. And that PCR test will be able to tell you if you have an active type of hepatitis C, so if it's a virus that's currently doing you damage, what genotype of hepatitis C it is, because there's actually quite a few different genotypes. So it's all hepatitis C, but there's slightly different versions of the same thing. And it will also tell you what your viral load is from that test. So it tells you a lot of information, that one test.
Now, Dr. Dhanak, since you worked in Pakistan, can you just let us know what are the treatment options available there, particularly in Pakistan?
Yeah, sure, Vanya. There are treatment options available. Like Nilan just mentioned, that there are different genotypes. So what happened previously was there used to be an additional test to find out that which type of genotype it is. Then there would be additional cost for the different medications. Now, recently, for about there is a 3-month treatment available, and it's for all of the genotypes.
We just talked about stigma. Anila, what stigma of hepatitis C is there in Australia?
Yeah, look, it's a really big problem. You know, this is a health issue. It's not something that people should be treated badly for. And unfortunately, it's one of the main reasons why people don't get the healthcare that they need. And if somebody talks to you about having hepatitis C, all they need is your support to make sure they get the treatment and get their health back on track. There's no reason to judge people for a medical condition. So stigma is alive here in Australia as well. And in the hepatitis C strategy, there are 3 main pushes. One is to increase testing and make sure that people find out if they have hepatitis C. 2 is to make sure people access the treatment, which cures more than 95% of people. And 3 is to reduce stigma. So it's hugely important in the health outcomes for people.
Is it true that the stigma is affecting the mental state and that self-esteem of the Hep C patients?
Yeah, look, in my opinion, a lot of the people that I have interacted with, it seems to have changed a lot. I think it was worse in the past. And also, one of the impacts of having chronic hepatitis C is it can actually make you feel depressed. So unfortunately, there was a mental health outcome that many people were experiencing from the hepatitis C, but then to be stigmatized on top of that was just really hard. And there used to be a treatment that also could be quite hard on people's mental health, but the treatment now is so much better than the old treatment and so much more effective, so much more accessible. The side effects are minimal. I think the worst I've heard is a small headache and a tiny bit of nausea. So we're in a much better place with hepatitis C than we used to be.
So there are some many myths around, hepatitis C that make patients feel isolated and discriminated. Can you share some of those myths with us?
Yeah, well, I guess, some people think that you can get hepatitis C just from giving someone a hug or sharing some food, which of course is not the case. So if people treat you that way, that can make you feel pretty terrible. If they suddenly don't want to come and if they don't want to see you if you're at the hospital, if they don't want to share a meal with you or give you a hug, that can really have a poor effect on people. And it's completely unnecessary. The only way that hepatitis C can transmit is from someone's blood getting into your bloodstream. So you can really have a very close relationship with somebody without having to worry about that.
Yeah, because I'm from Pakistan as well, and I've been in healthcare industry for a while also. I've seen many patients, they didn't used to tell you like they have hepatitis. They were so afraid and they felt so ashamed of that they didn't tell you when you were taking their histories and everything. So Dhanak, will you highlight that point? Why like they're so why they feel so isolated and discriminated and they hide their hepatitis. Even some people don't even tell their families that they have hepatitis. Can you like share some light on that?
Yes, that's a great question. You see, not everyone has sympathy for the person suffering from hepatitis C because they
Mhm.
think that the person has done something wrong and that's the punishment. So at this
Mhm.
point, I would like to bring in some of the examples. You see, even in our religion, it says that नफरत जुर्म से करनी चाहिए मुजरिम से नहीं. In English, it's like you should be hating the crime, not the criminal, right? उसके अलावा it's not necessary that the person is having hepatitis C because the person did something wrong. Even in the health section, the doctors are working, the nurses are working, the whole staff is there, and how they can get infected by just a needle stick injury. They weren't able to discard the needle properly, so they got a puncture wound. So did they do something wrong? They were actually serving the humanity. Another
Mhm.
important thing I would like to highlight is that the ladies, when they go to going getting manicures and pedicures, there's been a case reported that they have their own tools where they're getting the minis and pedis done, and there has been transmission from those tools from one person to another, because sometimes of course it can penetrate, it can give the infected person a cut or wound in the nail, and they don't sterilize it, and those tools are being used on the same healthy person. So the best suggestion would be to take your own tools to them. Just buy a kit for yourself. That's for the ladies' part. And as far as gentlemen are concerned, they can all get their own, shaving kit or whatever they're comfortable with. It's not expensive. Just take it to the barber and ask them to use it. I'm sure they won't refuse it. So
Mhm.
one thing is that, and there is high level of anxiety among people, the fear of transmission, that even if we sit near to the person, just like Nilan said, by eating with them, by sitting with them, it's not that how it's transmitted. It's the route of transmission is very different. It's not like the current COVID situation, like it's in the air. It's not in the air. There has to be a contact of the body fluids for it.
Yeah.
So don't isolate the person. Be nice to them. Be there to accompany them, because when someone is detected with a high blood pressure, you are there. Oh, I feel so bad for you.
Mhm.
I wish I could do something for you. But when someone is detected with hepatitis, you're like, oh, stay away from that person. We don't need to go at their place. And your other part, that they are afraid to tell to their people living with them at the home. That's very true. There are many cases in which the spouse doesn't look.
Mhm.
The spouse is unaware that their partner is infected. For instance, the husband got infection from from a quack, from a dentist or something. Dentists use to sterilize the stuff, the quacks, and he is infected. Sometimes the husband is himself doesn't know because he didn't do anything wrong. He is carrying the infection. He is symptomless. Then for some, in fact, I have seen cases in my experience. The wife was there for the hematomesis, that is blood in the vomiting, and it was like it's just acid reflux disease,
Yeah.
nothing more than that. We need to treat that. But when we did the workup, the patient was actually suffering from hepatitis, and
Mhm.
then we traced it out, so it was her husband, and then we traced husband, it was the quack. So it's the long chain. So yeah, awareness is very important, and don't isolate the person.
So, Neelan, coming back to you, many people believe that once you get treated for hepatitis, you cannot get reinfected. Is it true? How much of this is true?
Yeah, that is not true at all, unfortunately. So we're very lucky. We're very lucky that there is such an effective treatment to cure you of hepatitis C, but we do not have a vaccination, and we cannot stop you from getting it again. So even if you have undergone the treatment and you have been cured of hepatitis C, which usually takes from 6 weeks to 3 months, and is just taking a pill. So it's no injections, nothing invasive. It's just taking a pill. Then after you've gone through the treatment, they check and make sure it's cleared, but you can really catch it again
So
just
what are
as easily.
So what are the preventive measures do that person needs to take who is who had gone through the all hepatitis treatment, and there might be a chance that they might get reinfected? What other preventions other than drugs they can take?
Well, the only way to prevent yourself from being re-exposed to hepatitis C is if you think that there might be a chance that somebody else's blood is on something that you're going to be having interacting with your blood, find a different option. It's not a good idea. So if you're going to get a tattoo, make sure that you go to a licensed tattooist. There's a lot of people doing backyard tattooing. That's a big thing. The medical system is really well regulated in Australia, but it's not that way everywhere in the world. So depending on where you are, you might want to be really careful about where you go for medical procedures. Also, for intravenous drug users, it's a really big thing that we promote is harm reduction, which is basically if you're going to be injecting drugs, make sure you have all of your own equipment and do not share it. If there's anything happening that you think might put you at risk of being exposed to somebody's blood who has hepatitis C, find a different way to do it. That's really the only way to avoid getting re-exposed.
Okay. So Neelan, we talked this previously as well. How does COVID will impact the elimination of hepatitis C?
Yeah, well, we're still really learning a lot about what is the impact of COVID on hepatitis treatment. It seems that the data that's coming through globally and nationally is that people are not going to get tested as much. So it's really important to still keep doing the health checks that you think you need. And that's across the board. People are not getting cancers picked up as quickly. People are not going and getting their medication. You can actually have, telehealth is really great. So people can organise to get a referral to go and have a blood test, and then they can go to a clinic where it's quiet and they call ahead and they make, there's ways to do it, but don't feel like you can't go and get tested or access treatment. There's still ways to do that in COVID.
So coming back to Dhanak again, Dhanak, if somebody has a doubt that they might have, उनको हो सकता है कि कोई liver का issue हो रहा हो, उनको signs and symptoms आ रहे हो, then what are the steps they should take?
जी, अगर किसी को शक है कि उन्हें जिगर की बीमारी है, तो सबसे पहले तो वो अपने जीपी को अप्रोच करें। उन्हें वो आगाही होनी चाहिए कि मैं अपने लिवर हेल्थ से कंसर्न हूँ। So they would be giving out a prescription for the blood test. Just like Nilan mentioned, the first step would be to get checked for the antibodies. And in case it comes out to be positive, then there are a series of tests would be done. एक तो liver function test होगा, जिसे LFTs कहते हैं। इसके अंदर ALT होता है, AST होता है, GGT होता है, मुख्तलिफ चीजें included हैं। तो liver function test बताते हैं कि आपका liver जो normal उसकी functioning है वैसी है, अगर नहीं होगी तो इनमें से कोई enzyme ऊपर नीचे हुआ होगा। एक तो ये हो गया। फिर कंप्लीट ब्लड काउंट, उससे भी हमें पता लगता है कि रेड सेल का साइज, मैक्रोसाइटोसिस हो जाता है। मुख्तलिफ चीजें कंप्लीट ब्लड काउंट के अंदर जो है वो देखी जाएंगी। फिर आ जाता है आपका PCR टेस्ट। PCR में भी यही होता है कि वायरल लोड का पता लगता है, कौन सा वायरस इफेक्ट कर रहा है ये पता लगता है, और फिर स्कैन्स पे आ जाते हैं, अल्ट्रासाउंड होता है। ये एक लोगों की गलत फहमी है कि अल्ट्रासाउंड सिर्फ यूट्रस का होता है। लाइक पीपल थिंक दैट अल्ट्रासाउंड इज एन ओनली ऑफ द यूट्रस। आई नो, आई हैव सीन सम पीपल हु थिंक दैट, oh, ultrasound of the liver. So yeah, it can be done of the liver, it can be done of the gallbladder, it can be done of various organs of the body. So it's not limited for the uterus. One thing is this. Another thing that they can be a fibroscan. Fibroscan detect करता है कि कितना scar tissue आया है, मतलब how much damage has been done. वो उससे पता लग जाएगा. So there are a series of tests which can be done, which would decide, like the viral load will decide when the treatment can be started. And yeah, so these tests would be done, and after their results, it would be decided, when to commence the treatment.
Okay. Neelan, since you are a like health promotion officer, and we have talked about how hepatitis C can leave the patients isolated and discriminated. What advice would you like to give to the community that what they should do to support their patient, to support the patient of hepatitis C, so that they don't feel isolated at all?
Yeah, well, I mean, people are welcome to contact our organisation. We've got that 1-800 number again that we'll supply a link to. So, or you can come to our website and chat with us there, or send us an email through one of the forms. We have quite a big network of people in the community who are working on trying to make better outcomes for people around liver health and viral hepatitis. So in terms of within your own community, you don't legally have to tell people if you have hepatitis C. There's very few cases, times when you need to tell people. If you're joining the army, or you're undertaking a high-risk procedure in a hospital, or you're applying for life insurance, something like that, or health insurance. But generally, it's really up to you to decide who you want to tell. It's your information. But make sure you find somebody that you can talk to who can support you through going through the treatment. The treatment is so good now. I really, we've changed the scape of this so much. The best thing you can do for your viral hepatitis is get it treated and get cured, and you'll feel amazing. And you can also, come together with a lot of people who've had that experience through Hepatitis Victoria as well, if you want to be able to talk to other people about going through that process there. We even have a program called Hep Connect. So if you have gone through a big process or journey around your viral hepatitis, you can call up and say, this is what I've been through. I'd really love to go talk to someone who's had this experience, and we will connect you with someone who's had that experience so you can have a chat. But the main reason people call the 1-800 number or contact us, apart from advice about exposure, or, if they're a bit concerned, people often think that spit might be a way to transfer hepatitis, which it's not, or mosquitoes. Mosquitoes can't transfer hepatitis either. Yeah, so people ring and they check about those things quite a bit, but most often people ring to say, I want to get treated for my hepatitis, where can I go? This is where I live. So we can connect you with the best health provider in your area, who is not only caring and thoughtful around talking to people around viral hepatitis, but also, have access to fibro scans, and can make sure that they can get you, can prescribe you the medication. So it really makes it a lot easier if you can call and find out where your best clinical provider is close to you.
So these are one of these services your Hepatitis Victoria provides for hepatitis patients. Am I correct?
Yeah, that's right. Yeah.
Yeah.
So we don't actually facilitate the treatment. We're not a clinical organisation. We do training with clinical providers, but we don't actually have a clinic. So we triage people to clinics around them. So we connect you with the best provider close to you. And there's a whole lot of integrated hepatitis clinics around Victoria, which are really great, and they have fibro scans and can make it a lot more a lot faster and easier to get through treatment programs and access the care that you need.
So, Neelan, Dhanak, if I like, what advice will you give to the Pakistani community to, help prevent hepatitis in communities and help support patients with hepatitis as well?
Sure. देखिए हमारा जो मुल्क है इट्स इस्लामिक रिपब्लिक ऑफ पाकिस्तान, हमारे लोग मजहब की तरफ ज्यादा झुके हुए हैं, तो उनका कहना ये होता है कि जो कुछ है अल्लाह की तरफ से है, बेशक सब कुछ अल्लाह की तरफ से है। इधर मैं ऐड करना चाहूंगी कि कुरान में अल्लाह ताला फरमाते हैं लैसा इलल इंसाना इल्ला मा सहा, और इंसान को इतना ही मिलता है जितने की वो कोशिश करता है। थोड़ा तर्जुमा आगे पीछे हुआ हो तो अल्लाह मुझे माफ करे, but this is the meaning of the verse of the Quran, that a person would get for how much he tries. इधर में एक वाकया है आन हज़रत सल्लल्लाहु अलैहि वसल्लम के ज़माने का। उनके पास एक साहब आए और उनने कहा कि मैं अपना ऊंट बाहर खुला छोड़ता हूँ, बांधता नहीं हूँ क्योंकि अल्लाह हिफाजत करेगा। He was like that, I have a camel and I wouldn't tie my camel outside because Allah is there to protect my animal from being, stolen or anything like that. So our Prophet Muhammad sallallahu alaihi wasallam, he said that तुम अपने ऊंट को डोरी से बांधो, तुम अपनी तरफ से पूरी कोशिश करो, फिर अल्लाह के हवाले करो। That you tie the camel and then you leave it to Allah. You do your part and then leave it to the God. तो इधर ये सारे वाकयात कुरान की कोटेशन इंक्लूड करने की जरूरत मैंने इसलिए महसूस की कि बेशक अल्लाह रब्बुल इज्जत के हुक्म से पर्दा अभी नहीं झड़ता है, लेकिन आप अपनी तरफ से कोशिश तो करें। आप कोशिश करेंगे तो आपको उसका समर मिलेगा, उसका फल मिलेगा। अल्लाह ताला ने कोशिश करने से तो मना नहीं किया ना। आपको अगर तशखीस हुई है हेपेटाइटिस की, if you have been detected, if you have been diagnosed with hepatitis, then you have to try to improve your livelihood. You have every right to seek treatment. So go ahead, approach for the treatment, and then you leave it to your God, to Allah, that fine, I am doing all my best. और हमारे यहाँ ये भी होता है कि मेहनत करो, इम्तिहान में यही कहते हैं मेहनत करो, पूरी कोशिश करो, फिर अल्लाह पे छोड़ो। तो मेरा यही पैगाम है हमारी पाकिस्तानी कम्युनिटी के लिए, for all the viewers, that try your best to get the treatment and then just wait for the results.
Neelan, would you like to add something in that? That how we are as a community supposed to take measures to prevent hepatitis and support those who are going through hepatitis?
I would encourage you to, if somebody speaks with you about hepatitis, and maybe you can start a conversation with someone around hepatitis, that you treat that person with respect and support them to get help for their medical condition. Let them know they can call the info line if they want to get some more information. Also, if you know somebody who has hepatitis but they're not getting the treatment and you want to give them some more information, you can also contact us and we can send you out some information that you can give to them. Or if you feel like there's a certain group that could really do with some more information, we can arrange to have an education session. So, our role is entirely to support community, to make sure that people feel like they have everything they need to get the best health outcomes around this. So we're so thankful that Dr. Dhanak Hussain has come on board as a liver health ambassador and is helping bring this message out to people and encouraging people to get more information and access the health that they need. The healthcare that they need. And thank you so much for having me in this broadcast.
Thank you so much, Neelan and Dhanak. It's been such a pleasure. It's been such a relief to know that if you're going through hepatitis, if you have if you have been ever got infected by hepatitis, you can always talk to about it with somebody. And if you need professional help, you can search organizations like, as Neelan said, Hepatitis Victoria. when you'll go through Hepatitis Victoria, you can, search for mental well-being as well, and you can, talk to somebody about it. So thank you so much again, Neelan and Dhanak, for being here again. And we will take you, we will also talk about hepatitis B and A in other sections as well, in other segments as well.
Sorry,
the thing
just
is,
to add, I would just like to say thanks a lot, Neelan, Hepatitis Victoria, for having me as an ambassador. And yeah, I really love to represent Pakistani community, and I would love to see my people, improving themselves health-wise. So thank you so much, and thank you, Anya, for having me.
Thank you so much. No worries, no worries. याद रखिएगा कि we as a community, it's our duty, it's our soul, it's our responsibility to support those who are going through this condition. कोई सी भी condition हो, hepatitis हो, anything. हमें उन्हें isolate नहीं करना, उनको discriminate नहीं करना, उनके साथ खड़ा होना है, and if they ever need help, just stand on and help them out. So that's my message to you, and we had a very amazing session this time. और I hope आप लोगों ने उतना ही सीखा होगा जितना मैंने सीखा है. Hope to see you guys soon next time. Stay home, stay safe. मुझे इजाज़त दीजिए. अल्लाह हाफिज़. Bye bye.
Did you know your liver is your hardest working organ? That's why you need a healthy liver. Hepatitis, for example, is a serious liver disease that can kill you if you don't treat it in time. Get a liver test today. Your liver needs your love too.